on the bag there. Well, welcome to the 7 o'clock talk. And Nurse Jessica has done it. She has brought nutritional IVs to the Jennings County area. And actually, she can travel from Jennings. Where else can you travel to now?
You travel 1 hour from Madison, Indiana.
So, she's going to do her first IV at the clinic here, and I am the lucky recipient. And we are doing a glutathione with amino acids. And the reason why I choose glutathione is because glutathione is one of the things that as we get older, our body doesn't produce as much. And glutathione is the body's master antioxidant. By taking glutathione, you also do not suppress your body's own endogenous glutathione. I also take a glutathione sublingually so that I just want to supplement that. I do have SNPs, genetic SNPs, that do hamper my detoxification pathways. But luckily, nature, God, however you want to look at it, has a fabulous way of balancing things out because my body doesn't detox well. I do have a really good immune system. And so it kind of balances things out. So now, and I'll just be honest, I hate needles. Absolutely, positively, and possibly the biggest wuss in the universe when it comes to needles. But these things do so well, and I do feel so good after them that I suffer through it. It's kind of like I get my blood drawn, and to do my blood draw, I suffer through it. Otherwise, I don't like to get poked. I don't like to put more holes in my body than I already came with. It's all up to you. You want to talk about these and...
Well, we are going to be an extension of the Derma IV bar in Madison, Indiana. So we're going to be the Derma IV bar number 2. And Sue Langdon is the doctor of nursing. And she's been so kind as to help us bring this to our clinic. So when you come in, the IVs are going to be ordered the day before. They must be paid for. It's cash service, so they must be paid for before we have them mixed for you. And they must be done on the day of your appointment, or you will lose your IV and your dollars.
Ooh, good save.
So we ordered this earlier. Sue mixed them. I will go pick them up for you, and I will have them ready. It takes about an hour. Most IVs take an hour. You'll have about 4 pages worth of paperwork to fill out. The big thing is that you do not have any kidney issues.
Can't have kidney issues, myasthenia gravis.
Actually, I'll just let you talk about
the paperwork
if you would. Well, I get going because it does take an hour for the infusion to go in, and if he's talking, he won't worry about it. But
I won't watch.
The IV is very small. We're actually using a 24 gauge because we don't have to actually push anything.
That means nothing.
We do have the ability to do nutritional IVs. So we're going to start with probably about 6. I can hydrate. We also can use Zofran and Toradol. So Toradol is a pain medication, and Zofran is for anti-nausea.
And this is, Toradol is a non-narcotic.
It is pain medicine.
Yes.
It is a anti-inflammatory.
Yeah, that's what they give you when you have kidney stones. So, basically, you have your personal information, your address, acknowledge that you've read things, the Privacy Act.
Prior to, though, starting the IV, we are going to do like a mini assessment. the first time you come in, and we'll listen to your heart and your lungs, make sure they sound okay. Basically, what we're looking for is good lung sounds, no wetness in the lungs, and there's no arrhythmias of the heart. And we'll do your vital signs. So we'll take your blood pressure, your heart rate.
Mine's probably up.
Knowing you're afraid of needles, yes.
So consent for IV infusion, you have to give consent. I am not doing Toradol or Zofran. And last but not least, you have another page that you have to write your name on again. And they ask for current medications and supplements. And then they, and this is, I already do glutathione, NAD, probiotics, oh goodness, Mega Mucosa, IgG 2000, just a lot of maintenance stuff. The conditions that can prevent you from having this done. End-stage renal disease, how was my blood pressure?
132/88.
A little high, but that's to be expected. I expected it. Cerebral hemorrhage, hyperparathyroidism, myasthenia gravis, hypermagnesianism. I would be interested in seeing who has hypermagnesianism, because that is not something everybody in America is pretty deficient in it. Kidney renal disease, myxedema, low blood pressure, G6PD deficiency, a current UTI, hemolytic anemia, or cardiac arrhythmias. And then, so last but not least, have I been told to start dialysis, or am I currently on dialysis? And so that's basically the paperwork. Takes like 2 minutes to fill out. It's not bad. I'm not dead yet.
Nope, not yet.
So there are a lot of reasons why someone would want to get or should get. The funniest thing is these things have a history of partiers get nutritional IVs because it helps the hangover. You get dehydrated, you lose your electrolytes, all kinds of stuff happen, and so then the electrolytes, or then they rehydrate you, and the hangover is gone. I can honestly say I never wanted to ever have an IV for that. That doesn't register. I don't like to drink enough to warrant getting stuck. I don't like this part though. What else do we have? Why else would people do that? Oh, but a lot of athletes get the nutritional IVs because if you play hard, you deplete these things. It helps you keep from getting cramps. What else is there? Cramps. I am a wuss.
You don't like getting stuck, do you?
I own it. I'm okay with it.
And I think I'm on a bell.
Huh.
Oh, there we go.
She is good. I just am that big a sissy. So now, the reason why this is yellow, actually, glutathione is a sulfur derivative.
Now, if this hurts, let me know because it may be on a valve.
I'm good so far. Just
But I don't want to infiltrate you, so.
let her eat.
How long does this usually take?
Are air bubbles okay?
Those are not gonna hurt you.
I've seen too many movies.
Not too many movies.
It's burning
Is it burning?
a little bit. Don't mess with it. It's okay.
No, it's not okay. Okay.
Okay, what do we gotta do?
We're gonna stick it.
Oh, that's a bonus.
She doesn't usually do that.
Yeah. I don't know what the deal is.
It's okay.
Hey, Mom.
Because you're on the video.
Maybe at the end of it, you should show her Sue's business card, so they know where the other one is.
All right, now we're going for a twofer.
So what do you do with the other one when you hit a valve?
It's just a thing that happens.
You have to redo it because it doesn't go into the bloodstream, I'm guessing.
Well, it leaked.
What's the leak?
It just went. It's not going into the vein.
Yeah.
All I can see is your vest right now.
And that one is a good one. All I need is
Second time's charm.
bleeding all over the place here. Here. This is why we have leather chairs. Can you hand me that cute, that 4x4 there, please?
This?
4x4, the little gauze.
Gotcha.
We're just showing them it all how it works. So, y'all sweaty?
Oh, yeah, of course I am. You know I'm a wuss when it comes to this. How many times have you stuffed me and I wussified?
Because I need to get us tape to stick that down.
No, you didn't. So I survived yet again, and now I'm getting my glutathione. Back to the yellow. The yellow is because it is sulfur based, and your body uses sulfur to detoxify. That's part of the process. And so, got me all strapped down now.
Trevor, aren't you gonna put a band-aid on that?
Your mama will take care of it. She knows what she's doing. Not her first rodeo. Or even her second.
Okay, so we are using glutathione, and a lot of the times we are using things to detoxify the body. So there is potential to feel bad. You might get nauseous, you might get diarrhea, you might get a headache, and you want to explain to them why that is.
Because you are using something to assist the liver in getting things out. So your body will dump things out into the bloodstream. But I've already had a glass of water with electrolytes. I take glutathione nightly. What we're doing now is just tonight I don't have to take it. And this should actually keep me pretty well super saturated for a while.
It only lasts a month.
So you've got to stay on the hydration though, because the solution to pollution is dilution. the body has to use water to flush the kidneys, to flush everything out, and you excrete it through urine, sweat, and feces. If you don't sweat, you probably have a detoxification issue. But going back to the sulfur and the glutathione, which I'm really pumped about because I have a lot of patients who need glutathione. One of the things that we're looking at with this is that, you know, your broccoli sprouts, your Brussels sprouts, your broccoli, cabbage, all your cruciferous vegetables, these are the things that this is acting like. This is helping. Other than we're just giving it in a much larger dose. What else did I get? I got amino acids.
So this one
I think
has
I got
a-
some vitamin C.
So the
too.
so almost all of the bags have a multivitamin base. Seems like. This one has additional amino acids and glutathione in it. And Sue Langdon is the she's the doctor of nursing. She mixes all of them for us. She said the men really like the amino acids.
I've never had the amino acids before. I'm laughing though because I can kind of taste the sulfur a little bit.
And she did say that that was a problem sometimes for people. And she usually has lifesavers or mint. I don't have them currently.
I'm so used to.
I have one.
I'm
in
so
my
used
bag.
to it. I'm good. I don't eat those things. I'm okay.
Okay.
I
I'm
just
gonna
was
lay back
laughing
down.
because I know it's working because I can taste the sulfur. And it's what I taste when I put it in under my tongue. So usually I use a liposomal sublingual glutathione. Now I'm just getting an intravenous glutathione.
Trevor,
So it's just dripping in.
if someone like me were to come in and ask, because I am, what kind of IV would someone like me or me use or need?
Well, you're 10 years old. So you wouldn't really get one unless you were sick. If you were sick, then what would happen is you could get an IV for hydration if you were dehydrated. Say you were vomiting. This room actually has the ability.
We would be going to
To-
the hospital if I was vomiting.
This room actually has two entryways. So if someone is ill and wants privacy, we can bring them in the external door, and that door can remain closed. As far as other things for people, hydration's a biggie, especially if, let's say, you're older and you're having problems. You're sick. You've been sick for a long time. You don't want to go to the emergency room. You can do an IV that will do nutrition plus the multivitamins. Yes, Gracie.
What would we do for Granny? If we were to do anything for Granny, what would we do?
Granny would oh gosh.
She'd need all of them if you ask me.
No, you can't do that to her system. So for Granny, we would probably do definitely a multivitamin.
Would she need the glutathione?
I don't think you could do the glutathione because it would tax her kidneys and liver too much. You would probably do very little glutathione and then titrate it up, but that would be up to Dr. Sue. You'd have to talk to her and do that. I mean, when you're doing something there's a difference between doing it for health and doing it for illness. So
What would we be doing it for Granny? Health or illness?
illness. She would need illness care first, and then we could go into health care.
She is always ill. She always has been ill.
And that's why it would be illness care first. And then as she got better, then we would go into well care or health care. Yes, ma'am.
I was just going to get some paper. So we're going to start out small. So I was going to tell them kind of what we're gonna offer.
Gotcha. And honestly, the place down in Madison, they do a complete aesthetics line also. So not only do they do the IVs like this and mix the IVs for us, they do what all do they do down in
Okay,
Madison?
So
You'll need
Sue
to come
Langdon,
over here.
she is co-owner, along with Ashley. Ashley is a registered nurse, and Sue Langdon is a doctor of nursing. And they started out doing aesthetics, so they do micro needling, they do cryo
Sculpting.
sculpting, they do Botox, they do fillers, they do facials, they do massage. They have like a little conference room so they can shut down and do parties. Upstairs, they do all their IVs. Sue is awesome, and she also will do IVs, deliver an IV, and we will deliver IVs at for cost. We can do
Have IVs will travel.
Yep. We can do wellness IVs,
For
but we
people
also have
know.
the ability to do sick IVs because we have access to the back of the clinic, so we can safely provide care to people that are ill without making anybody else in the clinic exposed.
And vice versa.
Yes. So we thought we would offer IVs for hydration, for bad decisions. We'll be able to
That's what
provide
she calls the hangover cure.
Zofran for nausea, Toradol for it's an anti-inflammatory. It's really good for headaches. Let's see. Did you already talk to him about glutathione and the good and why that's good for you?
Yeah, detoxification. And if you're worried about your immune system, glutathione helps the immune system. So for COVID and those things, a vitamin C, glutathione with zinc, the immune booster, that just helps the immune system do its thing and fight.
We are going to do we're going to start out small, and we're going to do IVs for energy.
You're gonna do the weight
Diet
loss
and
one?
energy. It's a cocktail on it all its own. So diet and energy. There's an immunity one. It has vitamin C, the zinc, and the multivitamins.
Do you know the protocol for the weight loss one?
It's just in. There's no.
How often does she give those?
She does not like to give an IV greater than one time a week.
So that would probably be one time a week for X amount of weeks. I think that would be a protocol. You guys are still setting all of those up.
We'd like to do a hydration, and then there's one for a hangover basically, and that's a multivitamin hydration, and then it has the Zofran in there. We have the ability to actually mix our IVs based on the person.
Yeah,
So we can custom order IVs through Sue.
and she mixes all of those.
All IVs are mixed by Sue. They're picked up by me.
Now, let's talk about this for just a second. There is a difference between IV lounges, and you figured that out when you were researching this, and the reason why you went with Sue is because she follows all of the rules and does not walk in the gray.
Yeah, there's no gray. This is going to be a black and white, no gray. We are going to follow all her guidelines in HIPAA. So, just backstory: when we were researching it, then I found like, wow, this is crazy. So there's a lot of insurance
Can
involved.
you hand me that so I can?
They're watching you. Anyway, there's a lot of insurance and paperwork involved, and we weren't interested in cutting corners. So a lot of these IV bars we found them in Key West, we found them in Vegas, we found them in San Francisco, and I thought they were interesting because that just seems fun to me. Because I'm all about well care, not sick care. But when we went to research it for ourselves, the state of Indiana, unless you're in a facility where MDs are present, an NP has to mix the bag. And then the bag cannot be poked more than 3 times, even by her. All vials have to be used only once, so it makes it super pricey, time consuming, and the insurance
Yeah, the
was
malpractice insurance is crazy.
outrageous.
So, but you don't want people to cut those corners. You don't want them poking the bag multiple times. You don't want, these are safety issues for you.
well, we've heard lots of people like, well, the nurses from the surgical floor, they go
Their
around
side
and
gig.
give their side gig, their side hustle is the IVs. Well, they don't have an MD signing off on theirs. They don't have
They might not.
a lot of them do not have, and a lot of them do not cover themselves with the insurance. So we are super thankful and grateful for Sue, who also is all about people and their wellness, and she is not about cutting costs or corners. So we will follow all the guidelines. We will make sure everything is okay per Sue. We will stay with every person every time through the entire process of their IV. We have blankets. We have sounds. We can have music, or you can relax with a book. You can have lights on. You can have lights off. We're all about your comfort and well-being. So the first time you get your injection, your IV, a lot of times with IVs with niacin, especially, you might have flushing. You might get nauseous. If that happens, you should always tell us. We can slow the IV down. It doesn't necessarily mean we have to stop it. It's not necessarily an allergic reaction. It's just a niacin. That is a common reaction, but we can slow the IV down so it may take greater than an hour.
When I flush with niacin, bad.
Yeah, we have lots of lots of opportunity for growth. Sue has the ability to custom mix multiple IVs, but we also have the ability to use IVs for treatments
For functional medicine
with
patients.
Sue, because we have the ability to monitor through labs. So we're hoping to bring iron infusions possibly for some of our patients that need it. So our patients that may get COVID, we have the ability to hydrate. We have the ability to use Zofran, and we have the ability for Toradol. For a lot of times with COVID, they are getting migraines, and they can't eat or drink because they're nauseous. So if you have those problems or you're having issues, you do have to give us a little bit of notice because we do have to travel to get them. Like I said, we have to have it. It has to be prepaid before we get it. Before it will be mixed, it has to be prepaid. The IVs are only good for 24 hours, but they will only be good through the end of the day because once we have left. So
like if you know you're going out on a weekend and you're wanting the hangover IV, you should probably book that a week or 2 out. Big events and stuff like that. Definitely book that out.
we can come in on a Saturday. We are willing to come in on a Saturday for parties if you know you're going to go out and you're going to make bad decisions. But it would be nice to know that these are going to happen so that Sue can get
so
those.
we can have it all.
And
Because we don't keep this. None of this is kept on site.
No.
And to elaborate on that, We have the ability to hang 2 in here, so if it's a couple that wants to do them or try them out, we can hang 2 in here. And then if it's not clinic hours, we can hang 3 and 3 is 6. We could do 6 in the therapy room.
And well, we can put you anywhere you want to sit as long as you're okay with it being seen and it's not a privacy issue.
Yeah, as long as you're okay with, if you want to sit in one of the massage chairs and do it, let us know. We'll accommodate as best we can. And we got our new massage chairs.
Yep. And I am willing to travel with them. So if you are too sick to come, for a fee, we will bring them to you. If you don't want to come through the clinic, you just let us know. Like I said, this room has back door. We're just super excited about this opportunity, not just for our patients, but really for the community. A lot of times people are just sick and they don't have insurance. They just need a little hydration. Sometimes people are just really into their well-being, and you can really deliver multivitamins well, IV.
I kind of look at this like in my 20s and 30s and early 40s, I used to love to try different beers, and my health took a huge hit. And so I look at doing IVs like paying back a debt. You know, I went into a health debt because of my lifestyle. And now I have a fabulous foundational diet. I can even do dumb things once in a while and not pay any big price. But then when we go into doing something like this, it's just building health up.
Well, so I was able to sit and watch and talk with 2 of the people that were getting IVs today. One of them is a cancer patient, and she gets an IV every week. High dose vitamin C. That's really good antiviral, and it also, if you want to go and look up the studies, I mean, I don't have the studies in front of me, but you can go and you can look those up. And high dose vitamin C, when you use it early in cancer treatment,
Does wonderful things.
Wonderful things. So vitamin C itself is just amazing.
I have C in here, don't I?
No.
Oh.
This bag has a multivitamin base, has amino acids, and it has glutathione.
I guess I should go to the gym. Amino acids help with the muscle building. How am I doing, boss?
Good. About halfway.
I don't know if we have any questions.
Oh,
The
I guess
iPad
I
is
can do
just
it.
sitting over there.
So with these, they don't necessarily need to be our patient, like the clinic's patients. So like I said, this is kind of separate and a part of the clinic. No, you do not have to be a patient of Dr. Miller to come in and visit Nurse Jessica to get an IV.
Yeah, this is totally separate. You don't even have to like me.
Nope.
You can dislike me, but you can still come here and do this.
And so it is. We are going to be an extension of the Derma IV bar. Like I said, that is Dr. Sue Langdon. She is a doctor of nursing. She started the Derma bar out in Madison, Indiana, and expanded to nutritional wellness IVs. Super wonderful, nice lady. They do aesthetics, so I am looking forward to working with her and learning from her. And we will probably bring in the future Botox, fillers, and some
This needs
maybe
a whole
micro
lot of work.
needling into the clinic at some point in time.
If I was vain or cared, we would probably go broke. trying to fix my face. All the crow's feet and wrinkles, I figured I earned them.
Now, so I don't know if Trevor went over it or not, but so some of the side effects that you could experience, you should let the person know that's giving you an IV, whether you get one with us or somebody else. You may experience headache, some nausea. That is from detoxing. It's from the toxins dumping and the waste products dumping into your bloodstream. So you got to get rid of it, and you get rid of it by urinating,
Water, hydration.
sweating, and through your feces. You may experience diarrhea. Do not take an anti-diarrheal because of that. Your body is doing that to rid itself of the toxins. So you do not want to stop that. The diarrhea should stop when the toxins go through, but you do want to continue to hydrate
I
yourself.
wonder if you should use a binder. So, like, if you're detoxing all of this stuff, like, I'm going to take a binder after this. So I'll take some bentonite clay and or charcoal. I'll probably use the GI Detox from Biocidin. And
We actually were talking about this today because there was a little lady that was talking about how she does a detox program, but most people make the mistake that they are detoxing themselves, but they don't use a binder. So we talked about that, and she didn't really know what that was. And so a lot of times when you detox, you dump the toxins into your gut or your bloodstream. So when you're doing it through your gut, when you're taking oral detox, then you need to bind the toxins in your gut with a clay or a charcoal, and that binds to it and carries it through your intestines so that you evacuate it.
Makes it inert.
Otherwise, you detox, dump it, and then you reabsorb it.
So if you don't have regular bowel movements, if your bowel movements are loose, watery, and whatnot, these things are all issues that, yeah, you might want to also take a binder. I like to take a binder anyway because that has been shown to decrease the incidence of lipopolysaccharides. So anytime I'm taking like IgG or I take glutathione or whatnot, I will automatically just help my body. And that's one of the things that's a mindset we have to get as a society. We have to look at food as not as something we eat for pleasure or joy. It's either building you up or breaking you down. And there really isn't an in between, because if it's not building you up, it absolutely is breaking you down. And our society is not set up so that we're healthy. Our society is by no means set up for health. Our society is set up for capitalism and time savings. And those two things, you could be healthy in a capitalistic society. They just have to get rid of subsidizing sugar and all the crap. They really, really, really need to subsidize good foods. They need to put real food in the schools. They need to put real food in the grocery store, in the gas stations. For those of us that get in a crunch and are having a moment of weakness, it's a whole lot better to walk into a gas station and see some apples and oranges and stuff like that than to succumb to the insert name of candy bar here, pretzels, chips, whatever the food of weakness might be. But we're not set up that way. And we absolutely could be, because, 60 years ago, we didn't have these convenience stores. We didn't have the obesity rate the obesity rate just in my lifetime has more than doubled. I think it's tripled and then some. And that's just in 50 years. And we were listening to Dr. Hyman last night talking about this. And what's changed? People haven't changed. It's our food system. It's hard.
Oh yeah, we had
To
an
be
interesting podcast because they were talking about gluten. Just the gluten itself, it's wheat. Actually, they were talking about whole wheat being healthy, which caught our attention, but only healthy in other countries because it's the dwarf wheat that we have genetically modified in the United States that has either he
Since
said
1950.
400 or 4,000% more gluten in it, which is what is causing all the gluten sensitivities.
And what do they add to hamburgers to make those wonderful little patties? They add pink stuff, and the pink stuff has gluten in it. That's what makes it stick together. And it's called transglutaminases, and it's just, it's sad. It really is sad because we are children of the 70s. The food system just started to change. I did not have the education that I have now. And so my children, we were still kind of hippy dippy. But we did buy organic convenience foods, which have bad trans fats in them and still have gluten. Just because it says gluten free does not mean that it's gluten free. It just means that the parts per million are under a certain amount. And they have seen celiac and gluten issues be triggered in parts per billion. So just because it says gluten free doesn't mean that it's healthy for you. And hey, I'm down to my last quarter of a bag. I survived. Didn't pass out. Never have passed out. But if she was to take my blood pressure after this, it would be lower. Not because of the glutathione, but just because I'm not anxious anymore. I don't like getting stuck. Did I mention that? But tomorrow I will go to the bathroom. Here's a little TMI for you. It will be fluorescent bright yellow. I probably won't get diarrhea or have a loose bowel or anything like that just because I do this all the time anyway. The glutathione doesn't typically help me sleep better, but the NAD does, and I take that separately. NAD really, this is the thing about being able to do multivitamins and stuff like that. If you have gastrointestinal problems, you have celiacs, you have leaky gut, you have all of these things, you have to bypass the gut. And you have to go directly into the bloodstream, and you have to use liposomal forms so that the cells take it up directly, and you can help the cells. NAD does that for me, and I point to my Aura ring because if I take my NAD, you can see the incidence of my deep sleep increases. My deep sleep actually doubles. We do have patients who take omega-3s, and they said their omega-3s doubled their deep sleep to 2 hours. I actually, and we just bought some of the black currant seed oil. I take the Omega Genix 2400 and just started to add the other on there just to see how it does. Were there any questions on the thing yet? This is about as exciting as watching grass grow, huh? We'll have to share this with Miss Sue so she can show people.
Yeah, and then it's important for you to continue to drink afterwards to keep flushing out. Lots of water. Water is so good for you, and it's so important. So we already went through them, but like the body aches, the fever, the flu-like symptoms. You could get diarrhea or constipation.
Hey, Gracie, come here, please.
And in order to alleviate that, do not take an antidiarrheal, drink lots of water, avoid alcohol. You can try to bathe in your Epsom salts bath, your magnesium baths. That will help.
Get my phone, please.
Where is it?
Back on the desk.
Okay. I gotta take
And nutritional IVs, it just helps your body. Your body will absorb a IV
A lot better than a vitamin.
better than an oral.
Yeah. I think they say the absorption rate on oral is like 20 to 30% possibly. And it's like 80% with the IV, isn't it? I don't know. I don't remember.
It's way up there. Let's see. And you'll continue to absorb it. The only thing that you have to, the two things that are important to know that you do not want to give IVs is if you have active kidney or liver dysfunctions. We can actually give it to people that have congestive heart failure as long as your lungs are clear, and we just watch them. But we can slow it down if we want to. A big one that they've heard of, I know most people have heard of, is the Myers cocktail. That's kind of what everybody associates with a nutritional IV. And those Myers cocktails can be different depending on who's making them.
Everybody has their own recipe.
And then if you get a wonderful clinician, they can make your cocktail tailored to you.
So if we see nutritional deficiencies, we run a SpectraCell. I actually am thinking of a couple of patients who have poor cell health. Thank you. Who have poor cell health, and having poor cell health, I'm not getting up. I'm chilling. When it comes to a needle in my arm, I don't move. I would give you a hug.
Let's not be dramatic here. Let's just educate. That is actually not a needle in your arm. I removed the true needle. What you have there is an angiopath, which is a very thin tube of plastic. So most people are very afraid of IVs because they do truly believe that there is a needle in their arm, and there was a needle in your arm, but there is no longer a needle in your arm. And if you were to bend your arm, you're not going to go through the back of your vein. It would actually just bend the catheter.
That just weirds me out. You know, I don't think that I have phobias. I do have phobias.
He does. He gets very, very sweaty and white, whether he's being stuck or he's the one sticking.
Yeah, if you could see my leg. I don't know if you can see my leg. My foot's just down here, just swinging away.
My little tape won't stick because he's got this little
sweat.
Yeah.
Ma, you know there's blood on your thingy, right?
Yeah, that happens.
Yep.
Anyway,
so you got a good stick.
I stuck him over here and it hit a valve, and so it popped up there. So he may get a bruise there. So worst case scenario, so at least the worst, if we stick you and it's not successful, we can try again. You might bruise. Flu-like symptoms, diarrhea, achy joints, headache, nausea. The most extreme is embolisms, but that's in rare occasion, and that's the extreme.
Don't scare the people.
This from the 10-year-old who's afraid of vomiting.
I'm afraid of vomit. I'm afraid of people getting
I don't see
sick.
where this went live on our feed.
Do you think it's because you haven't posted it yet?
No, it should be live. Better be live. I'll have to go through this all again, which really doesn't bother me.
I don't see
Other than it be next week.
We're not recording it?
Oh, I don't know. I went live. I just don't see it jumped up on here. I thought it would be, but I was on my site. I wasn't on integrated site. I was going to see if there were any questions.
I don't see any comments.
There it is. I can see me. We did have a question. So, do you have a list of all the available IVs, and how much are they, and what are they good for?
We do have a list of IVs that we have available. We would like to start them out as simple IVs. We are still hammering out the costs. A basic infusion is going to probably be about $149. The additives, which include the Toradol or Zofran, those are add-ons. Those are, I believe, $40 extra each.
Yes, Kathy, I'm getting an IV.
It's going to depend on how complicated the IV is, as far as how much the costs are. But we should have a cost sheet made and printed up in the next week. What are they good for? Diet, energy, boosting your immune system, detoxing. A lot of athletes use them to reboost their system. We can do basic hydration.
Detoxification, unfunkification.
And those are from my perspective, but as a functional medicine physician.
Well, for functional medicine, so if you're a
can-
patient of mine and we've done micronutrient profiles and stuff like that, then we can start to do IV multivitamins so that we can boost your micronutrients. And remember, your body depends on micronutrients to actually survive and run all the metabolism, everything on there.
You are done.
I'm done.
Mom.
I'm to the bottom of the bag.
And so these IVs are 500 cc bags,
So half a liter.
half a liter.
I think I'm gonna drop some almonds.
And actually, I mean, really, since we have the ability to customize these IVs, they're really tailored to you.
Yeah, because I was one that wanted the glutathione. I added the aminos.
Now we don't. I mean, we would like to not stress Sue out and have her custom make every IV bag. But but we can.
Well, and this is kind of like I don't want to call it a concierge service, but it's a service that, we give her a little time. She can make anything. You can't want some sort of ultra personalized thing with, on short notice. That's not fair to her.
No, and I don't know if you. Can you see if I can see this? Actually, you can see this. So, Trevor, so if you have a fear, am I dripping?
Hold on.
If you have a fear of needles,
Take it. There you go. You're perfect right there.
this is, see how flexible that is? I'm trying to show you. Can you see it?
Yeah.
See how flexible that is? That is, the needle has been removed. So it's not going, it's not a true needle in your arm.
So basically, they use the needle as a sleeve, and then they put the little plastic bit inside you, and that way, my unrealized fear of needles and poking through the back and it ripping my arm in half are truly unfounded. But
They are.
that's what phobias are.
But
just like you don't like to walk across grates.
No, I don't like to do that. But yeah, So most IVs will take about an hour. You've seen how quickly, if I do a good job the first time, it takes less than 5 minutes to start the IV. It can have a risk of bruising. You may get cold. We have blankets.
I didn't get cold.
I didn't expect you would, but these nutritional IVs can be good for all kinds of things. Of course, you know, the cocktails that are just generic cocktails are good for what we said, energy, diet, rehydration, rebooting, immunity. But some of them you can get the NAD, and that's for dementia patients. There's brain fog. The customized IVs, which mostly Sue mixes her own for her patients, because her patients come in actually weekly for their IVs, a lot of them, and they are cancer patients. I'm trying to think what the other one was. They just use it just to boost their system. For instance, two of the patients that we drew today, they did not get their IV for 3 weeks, and both of them came down with COVID.
Yeah.
So get your multivitamins orally or IV. We're here to help. So if you have any questions, you can give us a call here at the clinic. We will, if we do not know the answer, we will get the answer for you. But expect to come in early. You will have to fill out your paperwork. There's about 4 pages. I will probably make sure that you understand it, and we've discussed it the first time thoroughly. The IVs are to be paid for in advance. We have to have at least 24 hours in advance to order it, because they do have to be picked up. If you do not show up for your appointment, you will forfeit your monies and your IV, because they are only good for a certain amount of time. If you are wanting it for illness, you are absolutely more than welcome to come. If you want to come through the back, you can do that. You don't have to expose anybody. I'm not afraid. We can absolutely come to your home. So
Another thing nutritional IVs are really good for, because it is a liposomal form of IV, is post-COVID syndrome. So if you have post-COVID syndrome, this is something you should really, really consider. I would probably even consider the NAD, but that is a bit of a pricey beast. And it's a long,
okay, so the NAD, I will, yes, so the NAD will, at the very minimum, is a 4-hour infusion.
So just to make sure you heard that.
But most people, the first one,
4 hours.
it will take between 4 and 6 hours for infusion. That means you will be sitting in a chair for 4 to 6 hours. That is the one that you can flush, get hot, and it is because of the niacin. That is a normal reaction. But it is great for dementia patients, Alzheimer patients, and patients with brain fog. However, if you're going to use NAD as a means of treating Alzheimer's, you must catch it early. It only helps in the early stages. It doesn't really help in the later stages.
Yes, NAD is a molecule that your body uses to help produce energy. And so NAD goes right into the Krebs cycle and supercharges it. And it's a fabulous, all-natural molecule. Your body also produces NAD. But you lose the ability to produce NAD. It's a tricky little bugger. It's not a common, simple, it's not a vitamin C by any means, but it is something that they are seeing have so many benefits in so many things, because it is one of those root cause super nutrients, kind of like glutathione. So
anyway, we are super excited to bring these here to the clinic, not only for myself, because this has been a big goal for me. This is something that I've wanted to do for several years. We're super excited for our patients. We're super excited for our community. We are super grateful for Sue, just opening up and allowing us this. But if you're local and you have aesthetic needs, please look up Sue and her team at the Derma Bar in Madison.
They do everything down
They
there.
sure do. They have a wonderful facility. It's beautiful. Again, they do facials. They do the micro needling, fillers, Botox, the cryo sculpting. What else did she do? Massage. But they have a really cool front area, and they have the ability to shut down and host parties for girlfriend parties, corporate parties. Just a really nice atmosphere there. But we're super thankful for Sue. Excited about our relationship that we're able to build for the wellness aspects for the community.
Thank you very much. You have a wonderful evening. And if you go down to the Derma Bar, tell them the Miller sent you.
Oh, and by the way, and so at the end of your, should we get rid of it?
No, go ahead.
Oh, at the end of your infusion, we will also take your vitals, which I'm getting ready to take Trevor's. So we'll get your post assessment vitals, and then we will make sure that you tolerated your IV well, and make sure that you have no problems. We will.
I didn't pass
give you
out.
water and
I
just
didn't
continue
drop
to
it
drink
at
your
the
water.
floor.
But anyway, we're super excited. Thanks for coming and joining us for our very first IV on our lucky 13 day.